8:42 now, and it's Lung Cancer Awareness Month. This particular type of cancer continues to be the #1 cancer killer in the U.S.
9 News medical expert Dr. Payal Kohli joins us this morning with some ways that you can protect yourself. Thanks for coming in.
Good morning.
This is really interesting because lung cancer screening is covered by insurance, yet a lot of people don't do it.
Yes, there's such a disconnect here. And so nationally, they say about 5 to 15% of people who are eligible to get screened. And here in Colorado, it might be even lower. And if you look at the barriers to sort of screening, I would say the biggest one is patients knowing that they're eligible to get screened. So that's what Lung Cancer Awareness Month is about, telling people when they should get screened. But there's also physician barriers. There are a lot of doctors who don't understand the guidelines for screening, and they're so busy screening for everything else, all the other types of cancers and heart disease and what have you, that lung cancer often falls off the radar, even though it is so deadly.
I was going to say, if it is, the deadliest cancer, why is there so much confusion about who should get screened, even among the doctors?
Well, part of the reason is because we're trying to screen the highest risk patients. So it's not one of those cancers like breast cancer or colon cancer where we screen every single person out there. We select out the people that we think are highest risk. And as we know, there are a lot of, risk factors for lung cancer, smoking being the biggest one, but even non-smoking related lung cancer can happen, especially here in Colorado where we have a lot of radon, for example, which is a huge risk factor. But the U.S. Preventive Services Task Force has really made a very specific criteria. People between the ages of 50 to 80 who are either current smokers or they've quit smoking within the past 15 years or who have a 20-pack year lifetime history. So to calculate your pack year history, it's how many packs a day you smoked multiplied by how many years. So 1 pack a day for 20 years is a 20-pack year. Now you can imagine that misses a lot of people that have non-smoking related lung cancer, but at least even getting those high-risk people, I think is a big deal.
Right.
Why is screening so important to survival?
Lung cancer is one of those sneaky cancers. It sneaks up on us because if you think about it, our lungs are huge, right? If there's a tumor growing in there, before it starts causing a cough or, having you cough up blood or causing chest pain or anything like that, it's got to get pretty big. So a lot of lung cancer is actually diagnosed very, very advanced, and we really have to change that. In fact, they're looking at this low-dose lung cancer CT, which is how we screen. We do a CT scan once a year, low radiation dose CT, and it can actually reduce dying from lung cancer by about 20%.
Wow.
And people are also looking at a sputum test. We've talked about it on the show before, coughing into a cup and seeing if you can pick up cancer cells by coughing into a cup when the tumor is very small and it may not actually even show up on a CT scan or in between the CT scans.
Well, as important as this is, we never want to cause alarm or anything like that, too. So before everybody wants to run out and get screened, who should not get screened?
Yeah, so they say at the lower risk groups, because if you think about the risks of screening, one is that you could pick up false positives, right? Sometimes we have a pulmonary infection and we'll end up with a nodule because our lung heals by scarring and making a little scar tissue and it looks like a cancer, and then you get more radiation. And so radiation is the other piece of it. Even though it's very low dose, you can imagine getting it every single year if you're very low risk can actually increase your risk. So if you're under the age of 50 or over the age of 80, you've never smoked, those are people that don't generally need screening. Now, if you have a family history of lung cancer, especially more than one relative, I would suggest you still go and talk to your doctor because there are non-smoking related lung cancers that can be high risk. If you've had asbestos exposure, radon exposure, any other types of environmental exposures that put you at higher risk as well, then you could talk to your doctor even if you're kind of outside of that box.
Why has lung cancer been stigmatized in a way?
Yeah, the smoking piece really makes lung cancer one of those cancers that people are embarrassed of. And this has really been another barrier to people getting screened because they feel like people might judge them, or if they do end up having a diagnosis of lung cancer, people might, pass a judgment on the fact that they used to smoke or what have you. So I think this month is really about destigmatizing the cancer and destigmatizing the screening and making people aware, covered by insurance, no co-pays and no co-insurance and no deductibles if you're one of those eligible groups. Yeah. And if you have a question, just pick up the phone, call your insurance company, but don't not get screened.
100%.
Especially living here in Colorado, we have a little bit of a target sign on us. We need to think about this very deadly cancer.
Don't let a stigma keep you from prioritizing your health. All right, Dr. Kohli, thank you very much.
And you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Chris?